Hello, my name is Andrea. I'm a nurse practitioner student. Can I do a head to toe assessment on you?
Absolutely.
Great, thank you. First, can you please tell me your name and date of birth?
My name is Istan Utirshov. My date of birth is May 10th, 1993.
Okay, this Stan, correct?
Yes.
All right. What's today's date, Miss Stan?
May 13th, 2025.
Excellent. And who's the president? Trump. Yes, he is. And where are you today?
LIU, Brooklyn.
Absolutely. Okay. I want you to remember these three numbers: 11, 22, 11. Okay? I'm going to ask you later. All right? 11, 22, 11. Okay. So, just by looking at Estan, his posture is erect. He doesn't appear to be in any distress. He's well nourished. Excuse me. I've already washed my hands, by the way, and I have on gloves now. He doesn't seem to be in any signs of distress. When I look at the skull, it's normal cephalic and symmetrical. May I palpate your scalp? Okay. All right. So, do you feel any tenderness at all?
No.
Okay. So, no tenderness felt. When I palpate the scalp, there's no masses or lesions. I'm just going to inspect the scalp. I'm a little short. Bear with me. Thank you. Okay, no scales, no lesions, no lice noted. Hair is well distributed. There's no signs of alopecia noted. Okay. When I look at your face, there's no ptosis. It's symmetrical. The nose is symmetrical to the face. There's no facial drooping. When I look at your eyebrows, the hair is well distributed. There's no crusting. There's no scales. There's no lesions. I'm going to palpate the temporal artery. Okay. Upon palpation, the temporal artery is +2 bilaterally. Okay. If you could take off your glasses for me. Thank you so much. Again, when I look at the eyes, the cornea is clear. There's no blood vessels upon inspection. The iris is a normal color. The pupils are 3 millimeters in diameter. The sclera of the eye is white. Okay. There's no signs of jaundice. Okay. There's no hemorrhaging noted. Can I palpate your lacrimal ducts? Okay. When I palpate the lacrimal system, do you feel any tenderness? No tenderness noted. When I palpate the medial canthus, any tenderness?
No.
No drainage noted. The lateral canthus, no drainage or tenderness noted. Okay. All right. Now I'm going to palpate your frontal sinuses. Let me know if you feel any tenderness. Any tenderness noted?
No.
Okay. Now I'm going to palpate the maxillary sinuses. Any tenderness noted?
No.
All right, excellent. Okay. Now, again, no jaundice noted, no hemorrhaging. The eyelashes are well distributed. There's no crusting. Let me look at the conjunctiva. The conjunctiva of the upper lids are pink. It's moist. There's no sign of hemorrhaging or infection. When I look at the lower lids of the conjunctiva, it's pink, it's moist, there's no signs of infection, there's no drainage noted. Okay, now I'm going to do a direct light test. Let me see, where's my, here we go. Okay, so I'm going to shine a light in the right pupil. And the pupil constricts, which is a normal finding. I'm going to do a consensual light test. I apologize. I'm going to do a consensual light test. I'm checking for constriction in both eyes. Excellent. Constriction noted in both eyes. Oh, now I'm going to do a consensual light test. Okay, I mean a convergence test. So I'm going to hold my pen up, and I just want you to follow the pen inward with your nose. Excellent. Okay. Convergence noted. I'm going to do an accommodation test. Now I want you to look at the cabinet. Okay, right, yep. And then follow the pen inward with Your nose. Excellent. Okay. Pupils are erect, round, and reactive to light and accommodation. Now I'm going to do a visual test, a visual acuity test using the Snellen chart. You can go ahead and put your glasses back on. Thank you kindly. Hold out so I want you to hold with the right, cover the left eye. Excellent. And I want you to read this line, if possible. If not, let me know.
LTFPH.
Okay, very good. Now the other side. Cover the right eye and read it backwards.
HPFTL.
Excellent. 20/20 vision. Noted. The cranial nerve 2 is intact. All right. Now I'm going to do an ocular motor test. That's going to test cranial nerves 3, 4, and 6. All right. So look at my pen. Just follow with your eyes, not with your head. All right. Cranial nerves 3, 4, and 6 are intact. Great. Okay. Now I want to assess your nose. Okay. Like I said before, your nose is symmetrical to your face. Okay. Can you occlude one side and breathe in and out? Excellent. Now do the other. Excellent. Do you remember those 3 numbers that I asked you?
Yes.
What are they?
11, 22, 11.
My man. Great job. All right. Now, recall is intact. The patient's oriented to person, place, and time. Now let's see. Oh, here we go. We're going to do the olfactory nerve test first. Smell test, okay? First, so I'm going to have you close your eyes. Tell me what you smell, okay?
Lemon.
Yes, very good. And tell me what you smell.
Something sour.
Yep, very good. Okay. Olfactory nerve is intact. Excuse me. So now we are, and also optic nerve is intact. I meant to mention that as well. Okay, so now I'm going to take a look inside the nose. Okay, so first I'm going to just lift the tip of your nose. Okay, thank you so much. All right, so when I look in the nares, it's pink, it's moist, there's no drainage, the septum is midline, there's no polyps, okay? Same with the right nair, there is no, the mucosa is pink on both sides. Again, the septum is intact, there's no drainage, no polyps noted, no redness, everything is normal. Okay, excuse me. So now I'm going to assess the mouth, okay? All right, so when I look at your lips, they're pink, they're moist, they're not dry, there's no lesions, no cracking, no scars noted. I'm going to take a look inside your mouth. I'm going to bring my tongue depressor as well. Okay, so say ah for me, please. Open. All right. So the hard and soft palate are intact. Mucosa is pink. All the teeth are in place. There's no hair on the tongue. There's no missing teeth. Can you lift up your tongue like this for me? Okay, excellent. The frenulum is intact. Now stick out your tongue for me. You can stick it out. Yep. Okay. The tonsils are +2. There's no exudate noted. And I'm going to just test your gag reflex. Okay. Testing cranial nerve 9. Oh, okay. Sorry. So cranial nerve 9 is intact. I'm going to have you stick out your tongue. Move it side to side. Okay. Smile, frown. Stick out your lips like this. Puff out your cheeks. Okay. All right. So cranial nerve 7 is intact. I'm going to palpate the TMJ. Open. Move your jaw from side to side for me. Okay, no clicking, Phil. Cranial nerve 5 is intact. Okay? And you didn't feel any tenderness, right, when I palpated?
No.
Okay, excellent. All right. Okay, now I'm going to assess the neck. So when I look at your neck, I don't see any swelling, any scars, any lesions. The skin is normal in color. I'm just going to palpate your cervical spine. Any tenderness?
No.
Okay, good. All right, excellent. I'm going to just palpate the front of your neck. Any tenderness when I palpate?
No.
Okay, excellent. All right. The trachea is midline. There's no deviation. I'm going to palpate the thyroid gland now. So when I palpate, swallow for me. Okay, good. Did you have any pain? No goiter felt? All right. So no issues there. Excellent. Everything is in normal limits. Okay, now I'm going to do a hearing test, okay? Excuse me. Sorry, I have something in my eye. Well, actually, let me just look inside your ears first. You know what? Before we do that, let me do a fundoscopic test on your eyes. Go ahead and take your glasses off for me. I'm gonna turn the light off. There we go. Mine works. Ha, great. Okay. Okay, so now I'm going to look into the left eye. You can turn towards me a little bit. Yeah. Excellent. So when I look in the left eye, the red reflex light is noted. Okay. There's no AV nicking. There's no hemorrhaging. Try not to blink for me. I'm sorry. Thank you. The optic disc is 1 to 2 inches. The margins are sharp. There's no hemorrhaging. The macula is yellowish in color with a milky sheen. Okay? Looks good. All right, I'm going to turn the light on. Okay. All right, now let's go back to the ear. Sorry about that. All right, so let me take a look in your left ear. So before I look, let me inspect. When I look at the ears, they're symmetrical. I don't see any scarring. I don't see any lesions. I don't see any swelling. Okay, can I palpate the ear? All right, so when I palpate, do you feel any pain when I palpate the auricle? Okay, what about when I palpate the tragus? Any pain? All right, great. Okay, now let me inspect the ear. Okay, so I'm going to pull the pinna up and back. So when I look at the tympanic membrane, it's pearly, it's gray, it's shiny. There's no perforations. There's a mild amount of serum in the ear, but there's no drainage, no redness, no hemorrhaging noted. And the cone of light is noted at 7 o'clock. And then I will do the same on the right ear. But the cone of light will be noted at 4 o'clock. Okay. All right. So now let's do you okay? All right. Let's do the Weber test. I'm going to bang my tuning fork on the counter. I'm going to put it on top of your head, and I want you to tell me if you feel the vibration or hear the vibration on both sides, or if you just hear it on one side. Okay? You hear it on both sides? All right.
Yes.
Yes. Okay. All right. Now I'm going to bang the tuning fork again. Okay, and I'm going to put it on the mastoid bone. I want you to tell me when you stop hearing the vibration. And for both, I'll explain it to you. Tell me when you stop hearing the vibration. Okay. Now?
Oh, well, I'm still going.
Still going? Okay. Okay, so air conduction is longer. I'm sorry. Yes, air conduction is longer than bone conduction. Okay, so there's no conductive hearing loss. Cranial nerve 8 is intact. Okay? All right. Very good. Okay, so now we're going to do the whisper test. Cover your left ear for me. Okay, I'm going to whisper something. Just tell me what you hear, okay?
1, 2, 3.
Yes, okay, I'm going to do the other side.
1, 2, 3.
All right, excellent. Yes, cranial nerve 8 is intact. Okay, no conductive hearing loss, no neurosensory hearing loss noted. Okay, so now I'm going to move on to the respiratory system. Okay, so first I'm just going to inspect the chest wall anteriorly and posteriorly. When I look at the chest wall, it's symmetrical. I don't see any signs of any scarring, any lesion, any retractions. There's no bulging. The skin is normal in color. There's no cyanosis noted. The AP diameter is 1 to 2. I'm going to check the posterior. Okay, the posterior chest cavity is, there's no lesions, there's no masses, there's no scars. Skin is normal in color. Okay, all right. Now I'm just going to palpate. Tell me if you have any tenderness, okay? Any tenderness at all when I palpate? Okay.
No.
All right. Now I'm going to do the posterior. Tell me if you feel any tenderness at all. No?
No.
Good? All right. Excellent. Okay. So now I'm going to percuss the chest wall. Okay. I'll sit on this side. Okay, resonance heard. Resonance heard at all lung fields, anteriorly and posteriorly. Okay, now I want to auscultate the lungs. So I just want you to breathe in and out when I put the diaphragm on your chest. Breathe in and out for me. Again. And I'm going to do the back now, posteriorly, in and out. In and out. One more time. Good. Okay. Now I just want to check for symmetry. Face the window. I want you to just breathe in and out for me. Okay, the rise and fall of the chest is symmetrical. Okay. All right. You can turn back. Oh, you know what? Actually, yeah, turn back around for me. Thank you. Okay, now I'm going to do the tactile primitives test. Everything okay? You good? All right. Okay. I want you to say 99, okay?
99, 99, 99, 99, 99.
Okay. Turn to the window.
99, 99, 99, 99, 99,
Okay.
99.
Excellent. Okay. Now I'm going to do the whisper pectoralicularly test. Okay. So I'm going to ask, oh, I'm sorry, resonance heard in all lung fields. Okay. Make sure you can see me. Resonance heard in all lung fields. Okay, so now I'm going to have you whisper 1, 2, 3. Okay? Every time I put the diaphragm on your back. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, I will do the same on the anterior chest wall. Now I'm going to do the egophony test, and I'm going to ask that you please say E every time I put the stethoscope on your chest, on your back, okay?
E, 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 E.
Okay, excellent. All right, no consolidation heard. Muffled sounds were muffled upon auscultation. Okay. Now I'm going to do a diaphragmic excursion test. Okay, so I'm going to have you breathe in and out. When you breathe in and out, hold it upon exhalation. Okay, while I percuss. So breathe in, out, and hold it. Okay. Okay. Now I want you to breathe in and hold it. Okay. Ready? Go. Okay. Okay. All right. Diaphragmic excursion is noted at 2 to 3. Okay. I'm gonna stop between here and here. Okay. All right. Excellent. Okay. You can turn to face me now. Thank you. All right. Okay. So now I'm going to assess the cardiac system. So I'm going to start with identifying the landmarks. So just make sure. All right. So here we have at the right second intercostal space, we have the aortic valve. Okay. All right. Now at the left second intercostal space, we have the pulmonic valve. At the fourth intercostal space, we have the tricuspid valve, and at the fifth midclavicular, intercostal space, we have the mitral valve. Okay, so now I'm going to listen to each heart sound. The mitral valve is the point of maximum impulse. Okay, so first I'm going to listen to the aortic valve with my diaphragm, pulmonic with my diaphragm, tricuspid with my diaphragm, and the mitral valve forward for me. Just lean. Yep. Okay. No S3 or S4 heard. Heart sounds are normal. Now I'm going to listen with my bell. Sorry. So when I listen with my bell, the aortic, pulmonic, tricuspid, and the mitral valve. And again, lean forward for me. All right, excellent. Okay, S3 and S4 are not heard. Okay, now I'm going to have S1 laid back for me. The bed is already at a 30-degree angle. Okay, I'm going to palpate each landmark on the cardiac landmark. We got the aortic. There's no heaves or thrills. Let me turn the computer so you can see. That's better. All right. So we have the aortic, the pulmonic. No heaves or thrills felt. At the tricuspid, no heaves or thrills felt. Or at the mitral valve, no heaves or thrills felt. Excuse me, I'm sorry. I didn't mean to scratch you. Okay, now I'm going to listen with my diaphragm at the aortic. That's the pulmonic, tricuspid, and the mitral. Okay. S1 and S2 are heard. No S3 or S4 heard. If you could turn your head to the left. Okay, no jugular vein distension noted. And to the right, no jugular vein distension noted. I'm going to palpate the carotid artery one at a time. Okay, +2 noted. You all right? +2 noted on both sides. Okay. And now I'm going to assess your peripheral pulses. Okay, so we already did the temporal, the carotid. Now I'm going to assess. You know what? I'll have you actually sit up for me. Okay. So the brachial pulse is noted here. Noted at +2. The radial pulse noted at +2. Okay. Just lay back for me. I'm just going to palpate your femoral pulse right in the groin. Okay, and I'm checking the inguinal nodes as well. There's no swelling, but femoral pulse noted at +2. The popliteal pulse. Okay, not palpable. Thank you. Okay, I'm going to just take your shoes off, if you don't mind. To palpate, sorry. Oh, don't mean to be rough. Okay, I'm going to just put your shoes here. And I'm going to palpate the pedal pulses. Okay, I'm going to just bring his feet up so you can see. The pedal pulses are +2 bilaterally, symmetrically. Dorsal tibialis is also +2 symmetrically, bilaterally. Excellent. Okay. Can you sit up for me? I also want to assess your lymph nodes, your cervical lymph nodes. Excuse me, all the lymph nodes in the neck. Tell me if you have any tenderness, okay? This is the preocular. Any tenderness? Postocular? Any tenderness?
No.
Occipital? Any tenderness?
No.
Good. Any, tonsillar? Any tenderness?
No.
Submandibular? You can push your head straight forward. Thank you. Submandibular? Any tenderness?
No.
Submental? Any tenderness?
No.
All right, good. Anterior cervical? Any tenderness? Posterior cervical? Any tenderness?
No.
Deep cervical? Deep superficial cervical? Any tenderness?
No.
Supraclavicular nodes? Any tenderness?
No.
Subclavicular nodes? Any tenderness?
No.
All right, excellent. Thank you so much. Okay. Now we did the peripheral. Now I'm gonna assess your abdomen. Okay? So you can go ahead and lay back. Sorry about the back and forth. Lay back for me. Put your feet up, make it comfortable. All right, so now when I look at the abdomen, there's no protrusions. It's round. There's no scars, no lesions noted. Do you have any pain at all?
No.
Excellent. Okay. So now I am going to percuss. So I inspected. I'm going to auscultate. I'm sorry. I'm going to auscultate the abdomen, starting with the right lower quadrant. Right upper quadrant, left upper quadrant, left lower quadrant. Okay. Normal bound sounds heard in all four quadrants. Now I want to percuss. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. All right. Tympani heard in all four quadrants. Now I'm going to do light palpation of the left lower quadrant. Do you feel any pain?
No.
In the right lower quadrant, do you feel any pain?
No.
In the left upper quadrant, do you feel any pain?
No.
In the left lower quadrant, do you feel any pain?
No.
Okay, good. Now I'm going to do deep palpation. Starting in the left lower quadrant, do you feel any pain?
No.
In the right upper quadrant, do you feel any pain?
No.
In the left upper quadrant, do you feel any pain?
No.
Okay. And the left lower quadrant, do you feel any pain?
No.
All right, good. Excellent. Okay, let me listen to the renal arteries while I'm by the umbilicus. Okay, no bruits heard upon auscultation of the renal arteries. Now I'm going to assess the spleen. I don't know why my screen keeps going dark there. Okay, so the midclavicular line. I'm just gonna, assess the spleen. Okay, it's not palpable, which is a normal finding. Now I'm gonna measure the spleen. Sorry, it's easier for me this way for some reason. Okay, so it measures at about 7 centimeters. Now when I do the liver, I'm going to palpate the liver on the right side. I don't feel, the liver is not palpable, which is a good thing. Okay, and now I'm going to measure the liver. So I'm going to start here. So the liver measures at about 7 centimeters. Okay. All right. So now I am going to do a musculoskeletal test. Okay. We're done with the abdomen. All right. You can go ahead and sit up for me. Thank you. Okay. I want to test your strength. Starting with your neck. All right. I want you to push your hand against your face, against my hand. Okay. All right, good. 5 out of 5. Let's test that cranial nerve 11. Go ahead and shrug your shoulders for me. Very good. And down. Excellent. Before we finish that, let me take your blood pressure. All right. Okay. So now. Just relax for me. I'll put the stethoscope on the brachial artery. Just relax for me. Okay, it was noted at 118 over 74. Now I'm going to take your radial pulse and your apical pulse. Measure for a pulse deficit. Excuse me. All right, so I'm just going to set my timer here. Sorry. Put my timer on 15 noted at 50. Your pulse is noted at 72, and your respirations are symmetrical and regular, noted at 14. And I'm going to also listen to your apical pulse. I'm going to set my timer again. Okay, all right. Apical pulse noted at 70, so there's only a pulse deficit of 2, which is fine. All right, now let's get back to the musculoskeletal. Okay, so 5 out of 5 in neck muscle strength. Go ahead and squeeze my hands. 5 out of 5. Go ahead and lift your thigh up against my hand. Good. And on the other side. Good. Okay. And push out and push your feet against my hands. All right. Very good. 5 out of 5. Okay. I'm just going to palpate the joints. Do you have any pain? Okay. Now what about at the elbows? So no pain at the shoulders, no tenderness at the shoulders, no nodules or anything felt. I'm going to just palpate your fingers, your wrists. No nodules felt. Any pain or tenderness? Okay, I'm going to palpate your hip joints. Any pain? Any tenderness? All right, excellent. Okay. Palpate your knees. Any pain or tenderness? No. Now your ankles. I just want them to see them. Palpating your ankles. No tenderness. What about the toes? Feet? No? All right, excellent. All right, no dips or pips felt upon palpation. Okay, and now I just want you, I'm going to test your range of motion. So I just want you to flex, extend, hyperextend. Okay, touch your ear to your shoulder, other shoulder, turn, and turn. Excellent. Okay. I want you to touch with your right hand, touch the left shoulder blade. Like that. Okay, and the other side. Excellent. And now, inward and internal rotation. Good. Okay. Range of motion within normal limits for the neck and shoulders. Go ahead and bring your arms out. Okay, bring them in, bring them back. Shoulder extension, up towards me, flexion. Great. Okay. I'm going to go ahead and ask you to stand. Okay. You can stand on the ground for me. All right. So I'm going to be able to see you flexing the hips. Okay. So go ahead, bring your knee up on each side. All right. Now I want you to kick your leg forward. Okay, and the other one. Extend it. Yep, perfect. Okay. All right. I want you to bend forward and bend backwards. Excellent. Okay, and side to side. All right, good. Turn around for me. Let me just palpate. I'll start from the cervical spine on down. Do you feel any tenderness when I palpate the spine?
No.
Okay. I'm going to palpate the scapularis. Well, any tenderness?
No.
Okay, great. Okay. Full range of motion in the hips, knees, the arms. Go ahead and bend the elbows and extend. Okay. Put your wrist out. Flex, extend, hyperextend. And out. All right. Doing that. And out. Very good. Okay. And the fingers. Spread them and close them. Excellent. Okay. Now I want you to walk from the window towards me. Okay. And back. Very good. Okay. I want you to do the Romberg's test. I want you to close your eyes and cover your chest like this. Close your eyes. And we're going to test it for 30 seconds here, okay? Let's see if there's any swaying of any kind. far so good. All right. Okay. Very good. I want you to go ahead and take your right leg and brush it down your left. Yep, and the other side. Excellent. Very good. Okay. Now, I just want you to walk heel toe, like walk from me to the window. Heel toe, like, I'm sorry, yeah, on your heels. I should have been more clear. There you go. And on the balls of your feet. Okay. Balls of your feet. Yep. Very good. Full range of motion of it. Okay. Have you go ahead and sit. I'm almost finished. Okay. All right. I do want you to lay back. I want to do passive range of motion of the hip. Abduction, adduction, internal rotation and external rotation, flexion, extension. Crunch your toes up for me. Bend your toes. Yep. Bend up. Yep. Flexion and extension. Internal rotation and external rotation. And I would do the same for the left leg. Go ahead and sit up for me. I just want to test your reflexes. Okay. We're going to do the tricep. Let's see so it can be seen. All right. One more time. All right. Now the brachioradialis. Okay. I will do the same on the left. Now the patella. Okay, very good. I'll do it on the left. All right. So I did the. Oh, let me do the. Babinski. That should be normal. Let's see what happens when we do the Babinski. Okay. Sorry to tickle you, but the toes didn't fan. So the Babinski was negative. Okay. And for a quick stereogenesis test, I just want you to tell me what. Close your eyes. Close your eyes. Close your eyes. Tell me what you're holding in your hand.
Like a coin?
Yes. Okay. And tell me what I wrote on your hand.
4.
Yes. Okay. All right. Can you tell me? This feels sharp, soft, or dull?
Soft.
Okay.
Sharp.
Okay.
Sharp. Dull. Dull.
Okay. All right. You've done a great job, Esteban. I really appreciate you for allowing me to do the head-to-toe exam. And that concludes my assessment.